All right, the manual muscle test of the gastrocnemius. It originates on the femoral condyles on the posterior side, inserts into the calcaneus via the Achilles tendon. Um, its action is to flex the knee and plantar flex the ankle. Is innervated through the tibial nerve on S1, S2 nerve root levels. The patient position would be standing. It's an active test, so there's no stabilization needed from the clinician or resistance from the clinician. The patient performs 10 single leg heel raises. They can hold onto a wall or table for stabilization and balance. Compensations to look out for would be not controlling the movement up and down, and not going up the same level each time if they drop down when they do a heel raise. All right, to manual muscle test the gastroc, the patient is standing and holding on to a wall for balance. She's going to do 10 single leg heel raises on her left leg. Go ahead. And while she's doing this, I'm looking that she controls the movement on the way up and down, and that she's going the same height every single time. She's going to go to the affected side now. All right, and that both are a grade or a 5 out of 5. All right, manual muscle test of the tibialis posterior. It originates on the proximal shafts of the tibia and fibula on the posterior side and the interosseous membrane. It inserts into all 5 tarsal bones and the bases of the 2nd through 4th metatarsals. Its action is to plantar flex and invert the foot, and is innervated through the tibial nerve at L5 through S1 nerve roots. The patient positioning would be side lying with the affected side down. To stabilize, you would stabilize the distal lower leg and resist at the distal base of the 1st metatarsal, and have the patient plantar flex and invert in one swift motion. It's good to give them a target to aim for and do that 1 or 2 times so they get the motion down, and then you can resist. There are no compensations since you are stabilizing the lower leg. It's just the only thing to look out for is to make sure that they invert and plantar flex at the same time and not 2 different motions. All right, with the tibialis posterior, she's side lying with the unaffected leg down. So I'm just going to give her a target. Hit my hand. One more time. Okay, good. Go back. I'm going to stabilize the lower leg. Go ahead. Pull. Now flip over. We're going to do the affected side now. That way. Hit my hand. One more time. Stabilize. One more time. Go ahead. Do it. All right. To manual muscle test the extensor hallucis longus, it originates on the anterior surface of the fibula and interosseous membrane. It inserts into the distal phalanx of the 1st toe. Its actions are to extend the 1st toe, invert the foot, and dorsiflex the foot, and is innervated by the deep peroneal nerve at L5 and S1 nerve roots. To patient positioning would be have the foot off the table or straight, or they could have their knee off the table with their foot hanging. You stabilize the 1st metatarsal, and typically on the side, so you're not restricting the tendon of the muscle. You resist at the distal phalanx of the toe, so over the nail bed of the big toe. The patient extends the great toe. You can put them into a bit of flexion so they can go through a full range, and any compensations, there are none. You're stabilizing so they can't dorsiflex the foot to help them out. and put them into flexion so you get a greater range for the test. Alright, with the Extensor Hallucis Longus test, I'm going to stabilize the first metatarsal head and pull your toes up. Okay, good. Relax. One more time, pull them up. Okay. Now on the affected side, I'm going to stabilize, make sure not to go over the tendon. Pull your toes up. Good. Relax. Pull your toes up. Good.